I'm Jessica Glosson, and I'm a dietetic intern currently rotating at Orlando Regional Medical Center. This video will demonstrate how to perform a nutrition-focused physical assessment. This form of assessment is used frequently in clinical settings in order to assess patients who are malnourished or at risk of becoming so. The nutrition-focused physical assessment contains a variety of components used to survey a patient's entire body in order to obtain a complete picture of nutritional status. Many of the clinical signs that we look for in this process are indicative of micronutrient deficiencies, which help to further a potential diagnosis of malnutrition.
Prior to beginning the exam, the RD should wash their hands and gloves should be worn throughout the assessment procedure. In the exam, the RD should introduce themselves appropriately and address the patient in an acceptable way. The patient should consent to the more invasive sides of the physical assessment exam. To begin, the RD should generally survey the patient's posture and body type. Looking for body symmetry is crucial. Look at the skin for any signs of rashes, bruising, discoloration, lesions, new wounds, or infection around injection sites. Assess the hair for its quality and texture. Looking at the nails can also be indicative of malnutrition. Spooning of actual nails can indicate iron deficiency. Interosseous muscles severely protrude, muscle loss or wasting could be occurring. Assess the temporalis muscle on the temple region of the head. Malnutrition would be indicative in a visible depression or concave indentation on the temple. Assess the orbital fat pads under the eyes. These contain subcutaneous fat. Any visible hollowing or dark circles would indicate malnutrition. Next, look at the eyes for signs of vitamin A deficiency, also known as Biddett spots. The nose and mouth can also indicate nutrient deficiencies and malnutrition. Make sure to observe the clavicle bone for visible signs of protruding acromion bone. If possible, use the fingers to feel the severity of the bone protrusion. A very prominent bone would indicate muscle mass loss. Next, assess the neck. Enlarged thyroid glands on either side of the neck that look swollen or protruding could indicate an iodine deficiency or inflammation of the thyroid. Check the shape of the patient's shoulders. Rounded off shoulders are normal. Protruding scapular bones or a very visible spinal cord or rib indicate subcutaneous fat and muscle mass loss. For the lower body, assess the thigh region for evidence of depression on the quadricep muscle. Look for bony knee protrusions that would indicate muscle loss around the knee. On the calf, have the patient bend their legs to assess if minimal muscle definition is present. This would be indicative of wasting. If the legs look uneven or non-symmetrical, note this. Have the patient make an L shape with their arm to assess the triceps and biceps region for fat and muscle loss. Pinch the skin underneath the upper portion of the arm. If a significant amount of tissue is between the fingers, that means the patient is nourished. Little space between the fingers means fat and muscle loss has occurred. Finally, look for signs of edema or the swelling as a result of fluid accumulation. Common sites for edema include the ankles, hands, feet, or the abdomen. Use the palpitation technique with 1 or 2 fingers to indent and touch the area to determine if edema is present and if it is pitting or non-pitting with pressure.
The use of the physical assessment can help validate nutritional interventions and diagnoses. It can also reduce patients' length of stay and improve their overall outcome by catching signs of malnutrition early and providing the appropriate treatment options. Oftentimes in inpatient settings, it is not possible for RDs to conduct full physical assessments on every patient they see due to the sake of time or the inability or lack of consent on the behalf of the patient. Thank you for taking the time to watch this video. The references used are provided on the following slide.